Hi everyone. Sorry for that little delay. My name is Anaya Huggins, and I want to welcome you and thank you for being here. Today we will be discussing rheumatoid arthritis, or RA for short. RA is a chronic autoimmune disease that affects millions worldwide. So understanding RA is essential not just for healthcare professionals, but for anyone interested in the broader impact of chronic illnesses. Today we'll explore its definition, causes, and a couple of different other things. And by the end of this talk, I hope you'll have a deeper appreciation for how we can collectively address the challenges posed by RA. As I mentioned to you before, here's a little bit of a look of our overview. So we'll talk about the definition of rheumatoid arthritis, its signs and symptoms, statistics, causes of rheumatoid arthritis, treatment, prevention, public health prevalence, and the conclusion, which are just significantly just my final thoughts. Here, let's start with the background. So, rheumatoid arthritis is not just about joint pain. It's a complex, systematic condition with profound implications for quality of life and public health. Its chronic nature often leads to physical, emotional, and financial challenges for those who are affected. The goal of this presentation is to provide a clear understanding of everything associated with rheumatoid arthritis, such as the symptoms, the underlying causes, treatment strategies, and public health importance. And by exploring these aspects, we aim to shed a light on how RA impacts individuals and society at large. Here, let's look at the definition of rheumatoid arthritis. So, RA is an autoimmune disorder where the immune system attacks healthy joint tissue, leading to inflammation and damage. This inflammation targets the synovium, which is the joint lining, causing swelling, pain, and stiffness. What makes RA distinct from other forms of arthritis, like osteoarthritis, is its systematic nature, which means it can also affect organs such as the lungs and the heart, which increases the risk of complications like cardiovascular disease. Understanding this mechanism helps us to appreciate why early diagnosis and treatment are extremely and crucially vital. Signs and symptoms. RA often begins subtly, but progresses over time. So some key symptoms can include joint pain, swelling, and stiffness, particularly in the morning or after inactivity. These symptoms often appear symmetrically, meaning both sides of the body are affected. Beyond um, joint, joint symptoms, many patients experience systematic effects like fatigue, weight loss, fever, and rheumatoid nodules. These non-joint symptoms highlight the disease's complexity and the importance of a holistic approach to care. Let's take a look at some of these statistics that I found. We're going to look at these points that I made in terms of epidemiology and global trends, but we're also going to look at this graph that I made from a source from the BMC Pulmonary Medicine that I used in my paper. So RA affects approximately 0.5 to 1% of the global population, with women being 2 to 3 times more likely to develop it than men. This gender disparity may be linked to hormonal factors. Over the past 3 decades, the global prevalence of RA has risen by over 14%, which is a concerning trend that underscores the need for awareness and action. Regionally, RA is more common in certain areas such as North America compared to other parts of Africa, where prevalence rates are lower. And understanding these patterns help us to target resources and research. As you can see in this graph, I looked at the RA incidence rate in 2019. So specifically in order, Africa had about less than 10% per 100,000. America had over 18%, Asia had a little bit over 12%, and so did Europe. So you can see you can definitely see the disparity between these two, well, these four specific continents or countries, depending on which one you're looking at. But also you can see the difference in terms of America and Africa and how that is a big jump changing in between the incidence rates between both countries and um continents. So causes. The causes of rheumatoid arthritis are multifactorial. Genetics play a pivotal role, particularly variations in the HLA-DR gene, which increases susceptibility. Environmental factors like smoking and silica exposure can trigger or worsen the disease, especially in genetic predisposed individuals. Um, Kind of on the flip side, lifestyle factors such as diet, maybe like having a diet rich in fruits and omega-3 fatty acids may offer some protective benefits. This interplay between genetics, environmental, and lifestyle highlights the complexity of RA and the need for a personalized prevention strategies based on the needs of each patient. So treatment. Treating RA is about halting disease progression and managing symptoms. The cornerstone of treatment is disease-modifying anti-rheumatic drugs, or how they call it, RMARDS or DMARDs, depending on how you want to pronounce it, like methotrexate. I'm sorry, don't. I'm gonna butcher some of the words of the medicines, but for patients with severe disease, biologics or JAK inhibitors may be introduced. These advanced therapies target specific immune pathways to reduce inflammation. So, non-pharmacological interventions such as physical and occupational therapy play a crucial role in maintaining ability and quality of life. Um, treatments treatment plans may or must be tailored to each patient, so it balances efficiency and potential side effects that could occur. Next, we're going to talk about prevention. Specifically, preventing RA focuses on minimizing modifiable risk factors. So this can include smoking cessation, is which is a paramount, as smoking is a key trigger for RA, especially in genetically predisposed individuals. Reducing exposure to environmental triggers like silica dust can also help. Um, Something else that we could think about is adopting a healthy lifestyle, which is eating a balanced diet, exercising regularly, and avoiding high levels of stress. Thinking about some of these things and implementing them in your everyday life can and may lower the risk further. And then also early detection through blood tests for markers like rheumatoid factor and anti-CCP bodies allow for early intervention and better outcomes and better health outcomes for the patients. Moving on to the next slide, we're going to talk a little bit more about public health prevalence. So RA's public health impact extends beyond the individual. The disease leads to significant healthcare costs, low productivity, and disability. Rural and underserved communities face particular challenges in assessing timely diagnosis and advanced treatments. Something else we need to think about is the high cost of biologics, which further exacerbate disparities. I know that I've learned a little bit about this in terms of like how public health programs and how public health creates solutions such as telemedicine and subsidized treatment programs. Um, these these events and programs are critical to reducing these barriers and ensuring equitable access to care. As you can see here in this graph that I created from Science Direct, we can see the the differences in how the cases and the number of prevalent cases in 2020. So you can see the differences based on gender by women and men. Women had about 12,700,000 cases of RA in 2020, whereas men had about three times less than that, which was about 4,870,000 men were had prevalent cases of RA in 2020, which shows a completely huge and big difference, which obviously shows how needing healthcare and making sure that all individuals have access to healthcare can help stop and screen and create more treatment strategies and awareness for individuals and get more individuals their right to a lot of medication. And it's just really beneficial to understand these specific statistics. Now, here are some of my final thoughts. So, in summary, RA is more than just a disease of the joints. It's a systematic condition that requires early detection, targeted treatment, and comprehensive public health strategies. By raising awareness, promoting prevention, and improving access to care, we can make a meaningful impact on the lives of those affected. Continued research and public health initiatives are vital to reducing the burden of rheumatoid arthritis. Here you see the references that I use. I mainly only use the references from my paper in order to complete this presentation. All of the graphs that I included in this specific presentation was something that I created from the information in the articles and sources that I used. So I make sure I reference them all here. And yeah. Thank you so much for joining me today to learn more about rheumatoid arthritis. This condition does not just affect individuals, but it also affects the broader healthcare system. So I want to open the floor to any questions and discuss how we can collectively contribute to addressing the challenges of rheumatoid arthritis. And maybe together, who knows, we can drive better outcomes for those living with this condition. So if you have any questions about this or about my presentation, or if you know someone who is dealing with this disease and dealing with this illness and you want to learn more or want access to this presentation, I'm more than happy to share. But thank you all so much for listening, and I hope you all enjoyed your presentations and had fun doing yours as well. Thank you, guys.